Good evening, everybody, and welcome to the annual joint meeting of the Adults in Health and Children's Scrutiny panels that's been convened to discuss the budget and related matters. I would, however, before we begin, like to welcome Councillor Paul Ainsley to the adult part of this panel, as he's joining the adult scrutiny panel for the first time tonight.
I'm not sure whether I should be insulted by that. No?
As a member of the panel representing the non-aligned councillors, if I was allowed to finish my sentence. But of course, he's very experienced in scrutiny as he chairs the children's panel for anybody who might be listening in public or watching at a later date. Paul and I have discussed this and we've agreed I will chair tonight's session rather than do what sometimes has happened in the past, and that is split it into two halves. We thought it would flow far better, particularly as we are on Zoom to run it as one meeting. But if anything happens to me, Paul will take over as he is acting vice chair for tonight. So could I remind everybody, please, to mute unless you are speaking to an item, and obviously unmute when you are speaking. It would also be extremely helpful if you could raise your electronic hand if you wish to speak. I do appreciate that technology periodically breaks down for all of us. So if your electronic hand isn't working, if you wave frantically, I'm sure either Jane or I will see you and we will be able to progress appropriately. So moving to the agenda proper, Jane, do we have any apologies this evening?
We have received apologies from Councillor Baines and Councillor Boole is frantically trying to get into the meeting, but seems to be having some IT issues, but we will keep trying.
Thank you very much. And do we have any declarations of interest from anybody on tonight's agenda? May I remind you, excuse me, excuse me, may I remind you that being a council taxpayer in Rutland does not count as an interest in this particular agenda. Councillor Beggy.
It's not an apology, Chair. It's just if I suddenly go on mute and pick up my phone, it's because I've got an issue with my son. So I'm not being rude. So just please
bear with you.
Accept my apologies.
Yeah, no, that's absolutely fine, Councillor Beggy. And we hope your son is not in too dire straits. Back to Jane then, if there are no declarations of interest. Petitions, deputations or questions?
None received, Chair.
Thank you. Questions with notice from members?
None received, Chair.
Thank you. Has there been any matter referred to the committee in relation to a call-in?
None received, Chair.
Thank you very much. So we move on to item 7, the draft revenue and capital budget. Can I remind you that when we get to the to discussing this item, that we are the adults and children's panel, and so the discussion should focus on adults and health and children's issues, and that the other elements that you might want to speak about will be considered by growth infrastructure and resources tomorrow evening. And specifically, I'm trying to find the right page here. The annex that relates to the People Directorate, the appendix, is Appendix 4. So any specific questions you've got in relation to Appendix 4, tonight is the night. Now, can I ask, please, are we having the portfolio holders introduce it, or are we having the director introduce the budget? Jane, do you know?
The report is from the director, but if the portfolio holder wishes to introduce it.
Well, looking at how keen Mr. Della Rocca is looking tonight, I will assume, unless he tells me otherwise, that it's going to be introduced by Mr. Della Rocca. But when he's finished, I will ask the two portfolio holders if there's anything they wish to add. Sav, over to you.
Yeah, no, sorry, Chair. I wasn't actually going to introduce it. Karen's got her hand up, so I'll defer to Karen.
Fine. Sorry, Councillor Payne, I didn't see your hand.
Okay.
You're wishing to introduce, are you?
If that's okay, Chair. Yes, please.
That's perfect.
Okay, thank you.
Thank you.
Thanks, Chair. We'd like to invite the committee to comment on the draft budget for 22-23, which is currently undergoing public consultation, as you may be aware. This is from now until the 9th of February. We're in the process of holding face-to-face public consultation events in Oakham and Uppingham Market, and we'll be pleased to see any of our residents in Oakham and Uppingham on Saturday, 29th of January in Oakham and on Uppingham on the 4th of February before the consultation closes on the 9th. The draft revenue budget you've had a look at, as far as the committee is concerned, totals 42.34 million, of which 13.9 million is for adult social care plus 5.8 million for children's social care. The ring-fenced dedicated schools grant of 8.3 million is not included in the 42.34 million, purely for the nature that it is ring-fenced and must be spent on education. This year we received a one-year settlement, which doesn't allow the council to plan adequately forward. But that said, we were actually pleased with the amount of grant we received from the government, which was slightly better this year than we had last year. It allows us to set the budget of 42.3 million using less than £100,000 of reserves this year, which is very different from last year. But this is based on or predicated on a council tax increase of 4.99%, 3% of which is for adult social care. We would have liked to have set this rate lower, but we face many pressures that are causing uncertainty in, as you're aware, a largely demand-led budget that we can't always control. Inflation is currently running at 6%, hitting fuel and running costs, and care agencies are passing these costs on to the council, presenting us with a pressure and challenge to cover the costs. In this area, we also have a new social care reform bill coming up. We don't know the detail of this yet, but it's likely to increase our workload and resource requirement in this area. Government funding to cover this is unknown at this point, hence we are carrying the financial risk. The committee have the draft budget to study. I won't take up any more of your time, Chair. My fellow portfolio holders and myself are open to any questions. Thank you.
Thank you. Can I ask Councillors Harvey and Wilby whether there's anything you wish to add to that, please? Well, I see no hands, so I'm assuming not at this stage. Thank you. So over to you, members. Questions and comments, please. Councillor Ainsley.
You're on mute, Councillor Ainsley.
I so hate myself. Yeah, I'll start again then. I'm looking at section 7.1, page 19, and I'll give you time to have a look at that. And I'm seeking clarification about item 2 in that table. We know that Cabinet is asking us to consider a council tax rise of 4.9%, of which 3% is for adult social care. In that table, we previously mentioned, it says that some extra flexibility is given to Rutland as we did not apply the full social care precept in 2021. What additional flexibility might we be able to enjoy? So, for example, does this mean that we could, should we so wish, increase the social care precept above 3% without the need for a referendum? not something I'm considering, but just really interested to know the answer to that question.
Councillor Harvey.
Thank you, Chair. I think what that actually means, as members will remember from last year we could have raised by 3%. As a council, we chose to raise by 1%. That saving deemed correct in the end, because adult social care have managed to maintain a saving of 500,000 this year. However, if we didn't raise by the full 2% this year, we would actually lose that raise. We couldn't carry it forward for another year. So it would be, we contemplating adding the 2% that we brought forward from last year plus the 1% that we could add from this year.
Thank you. Councillor Payne, I saw your hand up and it's disappeared again.
No, sorry, Chair. I think Councillor Harvey has answered as I would have answered. Thank you.
Thank you. Who's next then with their questions, please?
No more questions, Chair?
This is going to be a quick meeting. Councillor Powell.
Thank you, Chair. I have already submitted some detailed questions, which I've had some answers to. Thank you to Sav, and I just wanted to make sure that all those members' questions will be available to all members to see. That was my first point. One of the questions I've raised, I'm interested in, is about the posts in both adults and children. There's reference on pages 58 and 59 to the removal of vacant posts from the budget. Now, I understand that some of that is from restructures. I'd really appreciate a bit more clarification. Either posts that are vacant and needed to be filled, or why were they in there, if that makes sense? And what levels of vacancies are we currently running at the moment? Thank you.
Thank you. I had picked up the same point, and we have them in adults and in children. So could we have both covered? Mr. Della Rocca.
Yes, can I just pick up that there's a slight misunderstanding here that I just want to correct, and then I'll let the directors talk about the substance of adults and children's far better place than me. Simply put, we like to show the movement in the budget between one year and the next. So in last year's budget, as a for instance, is it feedback from me? Or I can hear feedback, forgive me. So in the budget last year, let's say, for example, we had 10 posts. We then show how that has moved on into this year's budget. So if this year's budget only includes 9 posts, we will tell you we've deleted a post. That's all we're simply doing here. People say, well, why was the budget in the why was the post in the budget? It's not in the current year budget, but it was in last year's budget. We're saying now we don't need it. And I think the question I got was, well, why is it in the budget in the first place? Because it was in last year's, and we're just showing the movement from one year to the next. I will let the directors explain why those posts are no longer in the budget for this year.
Thank you. Who goes first? Ladies first. Dawn.
Thank you, Chair. So I can explain in terms of from a children's services perspective, and I think the question is around the 126,000 that's in the report at page 58, 59, in relation to vacant posts being removed from the structure. To be absolutely clear, most of that budget was able to be removed from last year, because last year we had a significant number of social worker vacancies. I took a decision alongside obviously my portfolio holder and cabinet, that we would invest in a team of student social workers who would need paying, but also we required a consultant social worker post who managed that team of student social workers. They would be trained up and qualified within 12 months, and then they would be moved into the vacant social work posts. That is exactly what happened. So those 5 student social workers, the budget that was put in last year to pay for that team of student social workers is no longer required in this year's budget and moving forward, because all of those student social workers have moved into the vacant qualified social work posts on qualification.
Councillor Waller, you're muted.
Sorry, I muted to try and stop the feedback. I do beg your pardon, everybody. That was a very good and clear answer, Dawn. I'd like to move on to John to answer from an adult perspective, please. And then I'll come on to the other councillors.
Thank you, Chair. Excuse me. In particularly for adults, these were staff in our community care services, where we've been doing a lot of changes to remain efficient and to remain multi-skilled so that staff can move between services. For example, we were able to train some of our Brightway staff, some of our supported living staff to work with My Care, to bolster My Care during the pandemic, which has enabled us to fulfill much of the pressures coming from hospitals, because we created that efficiency. And we'd also been carrying a number of very long-term vacancies because it is notoriously difficult to get care staff. We were able to delete 2 of those vacancies. However, we attracted further investment direct from health services, enabling us to buy in 2 qualified occupational therapists, which was a win-win for all. It was a win for us. It was a win for our public to have professional engagement, and also for our services, because it's also enabled us to have a 7-day-a-week service, which we need, which we didn't before.
Thank you. Councillor Webb.
Thank you, Chair. Dawn, first of all, thank you so much for the work that you're doing all round, but it's good news to hear about the progress being made with Ofsted. So thank you very much to you and your team. Can you just help me to explain a little bit more about this 126k saving? So what I think I understood you said was that they were student social workers with 1 consultant social worker, but now they've gone into the vacant positions. So how does that actually then, sorry if I'm being really thick here, but how does that then save us the 126k?
So there was additional budget put into the staffing budget last year, because clearly I couldn't hold 5 qualified social work posts as vacancies, because that wouldn't I wouldn't have a safe service basically. So we had to backfill those on a short-term basis, but clearly I didn't need that budget ongoing.
Right.
That's what that bit means. Sorry.
Okay.
Yeah.
No, that's fine. That's great. Thank you.
And we don't need a consultant social worker at all any longer, because there's no student social work team to manage.
They're trained up.
they're trained up, they're fully qualified, they're
Yeah.
in post. Yeah.
Fantastic. Thank you.
Thank you. I saw Councillor Powell next.
So it's just to sort of complete that conversation, I think, and for members, it could be a question of, I totally understand the rationale and that will make sense. It could be a question of terminology, which I might ask, you know, to avoid misunderstandings like this. To me, a vacant post is a post that exists because the council needs that post, but currently we don't have anybody in it. Now, so that to me gave a different impression to what, and I understand the reasons for explaining it, but I think there is a matter of terminology here, which might be, you know, help for further clarification of that type of thing in the future.
Councillor Powell, do you think a term, for example, redundant post would make it clearer?
Or maybe posts no longer required or something like that, deleted, or they might not have been made redundant, but just I don't know, that's my understanding of what a vacant post is. That we have posts that we have we need the post in the structure, but nobody's actually in it. Just a thought. Thank you.
I think that makes perfect sense, and I'm sure the officers will put their heads together and come up with appropriate terminology going forward. I'm going to invite Councillor Cross now to have his piece before I move to the other portfolio holder.
Thank you, Madam Chairman. Well, I'd just like to commend the initiative of Gordon Godfrey in getting those youngsters interested in serving in such situations. And I think that's to be commended. I'm not too worried about the description you put on jobs. If it is right to delete such jobs for the sake of whatever, I think that's absolutely fine. Now, and then John Morley's team, again, another good performance, and obviously in the long run they're saving us money and the NHS money, and that is to be commended. So thank you to both of those directors for the work that you have been doing in this past year and will continue so to do. Thank you very much.
Thank you, Councillor Cross, and I'm sure we will all echo your sentiments, particularly around training our own, as it were. Councillor Wilby.
Thank you, Chair. The DCS, Dawn, has done all the spade work and hard work for the answers to the question that Councillor Webb put in beforehand, but I have put in written answers to governance so that they will be included with the minutes. I would like to just say that we have a contingency of 1% built into the budget should the need arise for things to ramp up a little bit. And because the numbers of our children that we're looking at, the UASCs, have gone up, you know, we're sitting at 7 at the moment. We have increased our virtual school capability quite markedly to make sure that we can give them all the succor and help that we can. So we're watching as that goes along, but at the moment we're at a place where we certainly can't afford to be complacent because the pandemic isn't over. We are also settling in some new staff into posts, and so we are just making sure that everything is ticking along quite gently. And you will have heard that we had a very positive outcome from our recent Ofsted, which I think showed that we were moving in the right direction. Whilst we may not be totally there, they were cognizant of the fact that things are in place to keep us moving in the right direction, and long may it be so. Thank you.
Thank you. Councillor Ainsley. Councillor Ainsley, you're on mute.
Yeah, thank you. I'd just like to echo the previous speaker's thoughts about the work being done by Dawn and John, doing an excellent job. My concern is about the dedicated school grant and the 1 million deficit that we're currently experiencing in the high needs because of high needs pressures. I recognise that we have no current obligation in statute to fund this deficit, but I am just mildly concerned about the effect of on our children, of the fact that we are experiencing a deficit, and children's services presumably are actually plugging the need that is exposed by this deficit, and whether that will come and bite us later. So I think that's probably aimed at Dawn, I suspect.
Yeah. I suppose first thing to say is the children's services budget does not plug any shortfall, obviously in relation to the high needs block of the dedicated schools grant. So the two, so that would be the first thing. I think one of the points though is probably around the demand on, or the ongoing demand on the high needs block moving forwards, which we obviously have seen an increase over the past 2 years in terms of demand, and we are forecasting that to continue. That being said, as you're aware, there is a SEND recovery plan, which is running alongside that demand, if you like, to which is running various projects to not just stem the demand, but also to move children out of that high needs block, so that their needs are met at a much earlier stage without the requirement to move into those specialist SEND services. And the two things are kind of running alongside each other. But as members will be aware, that is going to take a long time, and we're not forecasting that the SND recovery plan will be able to deliver a balance on the high needs block within the next 3 years.
Thank you.
Thank you for that. If I could just follow up, if I may. Yeah, thank you. I was aware that in the children's services, we're not going to be financially plugging the gap. I was much more concerned about the support given to our young people, given that with a deficit of £1 million in the high needs block, it's surely likely that there will be a drop in support, and that presumably would be supported. And you're saying no, that's not true at all.
No, it isn't true in the sense of what we have in terms of the budget, as in Rutland County Council budget. We are not reducing our support services at all for our SEND children. Whilst the demand has gone up, actually we're using part of the high needs block funding is being used to increase that support to children with additional needs, as I said, at an earlier stage, to prevent them moving through and up the tiers of specialist services.
Okay, thank you for that, Dawn.
Councillor Powell.
Thank you, Mr. Chairman. Can I ask just a specific question about one of the funded pressures, which was market sustainability of 92,000? It says we've received an extra grant for social care market sustainability. I'm just wondering, does that involve us in extra expenditure on staffing or consultants, and a bit more about that, or is it, is that going to be utilised against our existing expenditure? I assume that's adults, I don't know.
And I'm assuming that Councillor Payne's hand was up for a previous question. Did I, Sav, could you put your hand up? Are you prepared to answer that one?
Yeah, yes, I can. Just in terms of the construct of the budget, and yes, so we got the money from government. The funding, we assume in the MTFP that will need to spend that money. We this week received some indication of what the government expects us to do in terms of market sustainability assessment. That is still evolving, but we'll be given a set of tasks to do. So that money is accompanied by a set of tasks to do. And it may well be, the government seemed to indicate that some of that money might also be used to pay additional contributions to providers if the rates we're paying at the moment are helping the market sustain itself. But I'm not really sure how far £92,000 will go, quite frankly. But and that's a big concern. But we'll see how that unravels in due course. As we learn more about the adult social care reforms, and in particular the work we've got to do on market sustainability, we've had an initial project meeting inside the council. We will need to bring in some additional support to help us. This is a massive change, the adult social care reforms. We cannot do it with the existing staff. We need some additional resource, or maybe an internal secondment or something akin to that. And that is what we're looking at the moment. We understand we're going to get some new burdens funding from government to help us cover the cost of, you know, the resource we might need for implementation, waiting to find out what that is. But we also have had a meeting with the government department to say, can you please give us resource, i.e. don't give us money, but can you actually give us people who can work with us to help us do it? That would be even better than resource. And we are waiting for them to come back on that request. But I'm glad the question's been asked, because it's a piece of work that's beginning to worry John and I enormously, and it's going to have a significant drain on adult social care, the commissioning team, Andrea's, Revs and Ben's team. And it, you know, we're learning more about things as the days go by.
Thank you.
I don't know if you want to add anything, John.
Yeah, just to reiterate, Sav, this is a concern. We're going to have to look at the, as part of that sustainability of the care markets, a fairer price to pay them, which is an unknown at the moment. And the LGA, that's the Local Government Association, is preparing a tool to help us do that. If I can just add also, councillors, if I may, we have two other very large pieces of statute coming our way, which again, it's a worry, because this is on top of all the pressures that our staff are still battling daily, very tired staff, especially around the hospital discharges. In April 23, we are going to have CQC inspection for the very first time in adult social care. So that's going to be our equivalent of Ofsted. We still haven't had the guidance for this, even though it's going to be happening in April 23. That is going to be a phenomenal amount of work, because what I do know from my DAS colleagues is much of it is going to be based on data and the analysis of data. And then any improvement plans, of course, will need to be monitored. We are actually a very small team, and that's going to be resourced. And Chair, if I also may just add, we have what's called LPS that's coming out possibly in October. Now I've just been informed it's been delayed. It should have been this April. This is Liberty Protection Safeguards, which takes over from the Deprivation of Liberty, which is the Mental Capacity Act. Now that is a lot of power that adult social care has to help people that don't have capacity make best interest decisions, sometimes against people's will, because it's in their best interest. Now that means that we are going to have to employ extra people for that, because that is very specialist. Extra admin, because it's specialist, and coordination and managers. Now, I'm hoping again that comes with extra money, but that's three very large projects that we have this year and going into next year. And it does involve children's also, the LPS does, and of course, as Sav has mentioned, also his teams with the care cap.
Thank you for that, both of you, excuse me. Clearly, we as members need to understand a lot more, but I think all members need to understand a lot more about these legislative and regulatory changes that are on the horizon. Can I ask the directors, the three of you, to get your heads together, decide when and who is the best person to deliver, and actually use your director briefings for members to inform us at the right time of what's happening and what the implications are, please. I think it would be a very useful use of those time slots. And of course, they are open to all members to attend, rather than use scrutiny time, because briefings aren't really the purpose of scrutiny. So if that's okay, I see nods, so I'm assuming it's okay. Thank you. Councillor Payne.
Thank you, Chair. It's just to go back to Councillor Ainsley's point about the deficit of £1 million. This was on a list of topics that I had to discuss with our MP, Alicia Kearns, a little while ago, together with the unfairness of the way that the Rutland residents are treated as far as council tax is concerned. She has promised me, or is arranging a meeting with Kemi Badenoch, and this deficit and the writing off of the deficit is on that list of discussion with the Minister, just to advise.
Thank you. I think the very worst case scenario for us is if government decides that the deficit will be written off by means of the liability going to the local authority. I think we all have to be conscious of the fact that we are not unique. I think every single authority that has responsibility for education, children's social care has exactly the same problem to some degree. And obviously the larger authorities are likely to have, in monetary terms, a bigger problem than we've got. It will be quite a bill for the government to write off. But having said that, those of us who've been involved in this area of work for a very long time will recognise the costs of SEND have not been dealt with well by government over many, many years. And so I think it's almost inevitable that we are where we are. Sorry, that's my lecture for tonight. Do we have any more questions on this part of the agenda? I've got a couple of, I've got a comment, and that is the questions that councillors have sent in and have been answered. I'll come to you in a moment, Councillor Harvey. The questions that have been sent in, could they please, and I think I'm directing this at Jane actually, could they please, with the answers, be circulated to all members as soon as possible? I appreciate they will be included within the minutes in order that they are publicly available. But given that we will be having a budget council in the not too distant future, the longer members have to think about these things, the better. So the answers I know have been done from what's been said tonight. So if they could be circulated to all members, I would be very appreciative of that. I'll let Councillor Harvey come in before I finish my pieces. Councillor Harvey.
Thank you, Chair. I just wanted to speak a little bit more on some of the pressures facing adult social care. I'm aware that some of our residents might hear this, might watch this back. And obviously we are looking at raising the full 3% for the adult social care precept. And to our residents, that's on top of the national insurance rise that purportedly is to cover adult social care, but for the next year also will be going just directly to the NHS. Obviously, last year we were lucky enough that the adult social care team made a magnificent £511,000 saving. And despite the saving, are still ranked one of the best in the country and are an exemplar when it comes to innovative and partnership working with our health colleagues, certainly around hospital discharges, our RISE team and my care team. But some of the additional pressures, other than those that John's already mentioned, are including those things that are affecting us all. So things like inflation, national minimum wage rise, the care home costs are much higher now, but other individual ones. So our neighbouring authorities have raised their rates substantially to what we're paying our agencies. For our direct payment personal assistance, we haven't raised our rate of pay for 11 years now. It will be in April. So that does need looking at with the pressures on families. And obviously the new social care reforms, looking into integrated services, which will include a 7-day service requirement. And then obviously we have the massive £80,000 cap that goes out to all our residents, but obviously will really influence how much people will pay. So I just wanted to offer a bit more of an explanation so that our residents hearing this will have an understanding of why we're recommending the full 3%. Thank you.
Thank you very much, Councillor Harvey. I think that was a very timely intervention. I am aware that I have not heard members on these two committees question the value of why, but certainly filling in the detail does help, I think, when our residents are asking us the question. So thank you for that. The one bit you missed out, though, was fuel bills. And our care homes are going to have much higher fuel bills as well as everything else. My other question, or my final question, is actually for Dawn and for John. We've been talking about savings, about restructures and so on. Do you think, both of you, and I'll start with John this time, I won't do ladies first, I'll do gentlemen first. Do you think your structure is right for now? And do you think you may have to do structural changes going forward as the world changes? And I'm talking about the short to medium term, not our lifetimes. John.
Thank you for putting gentlemen first, Councillor Waller. And my answer is yes and yes. I've got, I think our structure currently is proven to be working very well. And that so much isn't the titles of the people, it's the people themselves. So it's my senior team and the managers under them that make up the structure, that are very passionate about their work and are very conscientious and work for us, you know, which has borne these results. And they get a great deal of satisfaction, and that is also borne out in our very low adult social care staff turnover, and it's been like that for a number of years now. So yes to that. Yes, also that we are absolutely going to have to adapt, Councillor Waller. There's no doubt about that. We've adapted so far over the years. For example, when the Care Act came out, there's been different changes in legislation. Even now, actually, we've adapted our senior team in the last 2 years during the pandemic. And I think this is one of the keys. You're a council that allows us to be flexible and dynamic and to react and to adapt. And that's very important, because I like to think that you trust the services to do that. And that has certainly been borne out. I think going forward with the ICS, so that's the integrated care system, where we are further expected to integrate with health, and the awaited integration white paper, which we don't know a great deal of what's in that. We're going to be knitting closer to other agencies, and there will be opportunity there and I've underlined the words opportunity, perhaps to start merging some structures to make us more efficient. The public, vulnerable people won't have to tell multiple stories multiple times, and there would be one record, for example, like the care record that's being put together. So one computer system. That's been a bit of a golden chalice aim for the last 20 or so years. A long answer, but yes, but I think it's full of opportunity with your support.
Thank you. Dawn?
In a way, it's a similar answer to what John's given. So I think what we've done in children's services in terms of structure over the last couple of years is we've flexed our structure within existing staffing budget, so that's the important thing, but what we've been able to do is look at opportunities to make sure that we're making the best use of the resources that we've got. I've been very keen to very much see children's services across the whole of children's services, as opposed to having silos of children's social care, early help, SEND, learning and skills, and looking at the opportunities that we have to kind of support across the services. That will continue. There will be, the world of children's services is a bit like adults. It's ever changing. There's always something new around the corner from the Department for Education. So as I said, I think I can't sit here now and say the structures wouldn't change in the medium term, because I don't know what's around the corner in terms of what we might need to react to in terms of either central government policy or even demand, local demand, which might impact. But certainly I'm not looking at any wholesale restructuring for children's services.
Thank you. Are there any other questions on this paper? Fine, thank you. We were charged under item 7 to provide comments and views. I think we have provided a large number of comments and views. I'm not sure necessarily that they would have been helpful for Councillor Payne and for the director, because a lot of our comments were not specifically budget related in the sense of a comment. They were obviously for our questions, but nonetheless, I think it's been a useful session. So thank you. And can we move on, please, to item 8, fees and charges? Now, again, it's report from the Strategic Director of Resources. And again, we're being asked to provide comments and views. And I would draw your attention to Appendix 1 to this report, where the adults and children's fees are specifically identified. Councillor Payne, are you introducing this one as well, please?
Yes, I can do.
Thank you.
It's a fairly short introduction. Thank you, Chair. This is obviously part of an annual review that the council does of its fees and charges. The committee is due to comment on Appendix 1. I think it's fairly self-explanatory, and we're happy to take any questions.
Do we have any questions from anybody? Councillor Powell.
Thank you, Chair. It was a question I already put in, but I was not totally clear on the answer. So if we look at, for example, the first item in Appendix 1, which is deferred payment agreement setup, increasing from 524 to 550 in line with inflation, 5%. Yeah, that's on page 87. How much does it actually cost us? When was the last time we actually looked at the cost of that DPA setup? And are we just covering our costs? Have we got a built-in addition in there? Is it keeping up with, is fine increasing it by inflation, but structures may have changed? There might be changes in the way that's delivered. I just picked that as an example because it's the first on the list, but it applies to all the charges in terms of analysis of actually what the costs are, rather than looking at a year by year increase as a percentage.
Sav, please.
Yeah, yeah, I'd have to come back on the detail related to that one. We do look at the fees and charges every year, and we look at the cost breakdown. We don't go to the nth degree on it, for the simple reason is Andrea does about 3 of these a year. So the simple reality is to work out the exact costs on 3 a year is relatively quite quick to do, because it's how long do they roughly take, Andrea, in terms of time? And is there any additional legal fees associated with it? So in some instances where the volumes are very low, quite a quick process. For things like green waste, it's a lot more scientific, more detailed calculations behind it. I'd have to go back on this one because I think it's a combination of staff time and legal time as well. And I don't know the breakdown of how that works. It's been increased by 5% to reflect that, but I'd have to go back and get the breakdown. But there's so few of them, you know, it's easier when you've got a team doing it, like on land charges or whatever. It's easier because you've got a cost centre with dedicated people who all they do is do things where you recover a cost. When it's like 4 hours a year of Andrew's time, it's not quite as straightforward, but that's how it works. I can get the breakdown of that if you're interested.
Thank you. Councillor Powell.
Could I just come back? Yeah, I don't know that I need a specific. I was just questioning the principle of how often the actual costs were looked at. Does that mean they're actually looked at 3 times a year, or whether it's just one? We look at it for one particular item every few years. I'm sorry, I'm not quite.
Well, it's looked at. It is looked at every year, and we have to satisfy ourselves that depending on what the legislation is around the charge, whether it's cost recovery or otherwise, that we're doing the right thing by that. And so we have to look at it every year. I think the example I used back in my note to you was the green waste charge, because that is one of our biggest areas of discretionary fees, whereby previously members talked about we'll have an inflationary increase every year. But actually, inflationary increase in the green waste area has not been permissible because it wouldn't recover our costs. Because when we ended the contract with our waste management contractor, the cost went through the roof, didn't go back up by inflation. So we had to look in detail at the costs and make sure the charge was increased by to cover the total cost. In doing so as well, members made a decision that they wanted people to be able to ring up and subscribe for a green bin. There are some people who do it online. We know that by ringing up costs us more to process than it does online. So we varied the charge. Members actually, as part of the July savings work last year, approved 2 charges. 1 charge if you subscribe online, 1 charge if you subscribe over the phone. That epitomises our approach, because we wouldn't do that if we were looking in detail at the costs and understanding that a different approach costs us a different amount of money. So we do look at these things because we've got a £2 million deficit, so we can't afford not to look at anything and make sure we're recovering our costs. In the past, we've been challenged by members of the public that we're recovering in excess of costs in certain areas. And we've had to deal with that. So it is something we look at closely. I wouldn't want members to think that we're not trying to recover the costs that we incur or maximise the charge if we can.
Thank you.
Powell, do you want to come back on that?
Okay, so what you're saying is that you do actually analyse the costs, and these are set at cost recovery, including your normal recovery of overheads and fixed charges as well. Yeah, okay, thank you.
Well, I have a different question if there's nobody else, and that's in relation to admissions. And I do understand what the service is, having run that service when I was working some years ago. But my question isn't about what it is. My question is about what we charge schools. And in our note, it says that the charge is agreed by the schools forum. Well, if I was at school on the schools forum, I would want any charge to be as low as possible. So are we confident that we are at least covering our costs with these charges? Because I'm sure our schools are going to try and argue us down rather than up.
The short answer is yes, we are recovering our costs, and I haven't got a crystal ball, so I don't know what schools forum might do in June in terms of an inflationary increase, but certainly I would anticipate that that would be agreed as it has done in the past.
Thank you for that. Anybody else got any questions on these fees and charges? Okay, thank you. Well, moving on, we reached the end of the meeting. Can I ask you to note that the next Adults and Health Scrutiny Committee is on Thursday, the 17th of February, and the next meeting of the Children and Young People Scrutiny Committee is on Thursday, the 24th of February. Those are our scheduled meetings. And as there's no further business, I declare this meeting closed at 7:57 or 19:57.